Hello everyone. Today I am discussing common problem a mother faces while breastfeeding. So the first problem is flat or inverted nipple. For that she has to prepare her breast during the last few weeks of pregnancy. While taking bath she can clean nipples so that the rust over that get removed, and she can pull it outside so that the problem of inverted nipple gets solved. The next commonest problem is tight breast or breast engorgement, which usually occurs on day 3 or day 4 of delivery. What happens because of venous and lymphatic engorgement, the milk not easily able to come out. So the breast become painful and the mother sometimes develop feverish feeling also. So what you can do for that? We can manually express the breast milk, or we can use gentle breast pump to relieve the tightness. Start breastfeeding as early as possible. In case of normal delivery, within half an hour, and in case of C-section, within 2 hours you can start the breastfeeding. Then the third most common problem is cracked nipples. It's a very painful condition. A very small ulcer or a fissure appears on the nipples. The mother develops in severe pain while breastfeeding. So again, for that she has to maintain the hygiene. The nipples should not become dry. For that she can use purified lanolin ointment frequently to avoid the dryness, and proper attachment she has to learn. So two most important thing I am telling again and again. First is positioning. So what do you mean by positioning? So how she is sitting and attaching the baby to the breast. So she can either sit with support, or she can lie down in a lateral position. Then we can understand it on a demo, the proper attachment. Look, here is the nipple, and around that there is a darkened area, what is called as a areola. So when you start breastfeeding, you have to extend the baby's neck slightly so that its baby's mouth get widely open, and you have to insert the nipple along with that the areola inside the baby's mouth to form a teat so that the baby can feed the breast milk. Cracked nipples will not occur. So proper attachment you have to learn, and it's very important. So how will you understand the baby is properly attached? When the mother will feel relaxed and the breastfeeding is not painful, and the chin of the baby touches to the breast and there is skin to skin contact, then what we call as it is a proper attachment or latch on. Then the next commonest problem is the mother and the granny always think that the breast milk is not enough. Because some parameters you have to understand. If the baby is passing urine adequately, means 2 to 3 times a day, and the baby is looking healthy, its skin color tone is pink and firm, and baby is playful, and baby is taking sound sleep of 2 to 3 hours after each feed, and the weight gain is between 120 to 210 gram per week, then you can assure yourself that the breastfeeding is enough. But if the parameters are not meeting, the weight gain is not there, then you can ask your doctor to have some medicines for the enhancement of the lactation. When the mother feeds the baby, what we called as foremilk and hindmilk. So the first part is the rich in watery content which satisfied the thirst of the baby, and the latter half which is rich in calories and fat which satisfied the satiety of the baby. So you have to put the baby for 5 to 10 minutes on each breast to make it empty, and then only you can shift to the other breast. Then the next is burping. Along with milk, the baby swallows lot of air. Because of that, the baby may develop colicky pain, or the baby may vomit sometime. So the mother has to take the baby in proper position so that the baby's chest rests on the mother's shoulder, and she can pat slowly on the baby's back till the baby burps, and again then she can continue the further breastfeeding. Most important is mastitis or breast abscess. If infection develop in any of the lactiferous tubule, then it goes into deeper and it can form a infection. So how will you know whether you got infection or not? Then you may develop severe pain in breast, then you can feel the lump, or the breast become hard or red colored, and sometimes you may have high grade fever and chills. So if you have such kind of symptoms, then you will immediately consult your doctor and start the treatment. To avoid this complication, you have to maintain your hygiene. You have to take daily bath with gentle soap, and you can use purified lanolin ointment to avoid the dryness and cracking of the nipples. If you have too much engorgement, then you can use gentle breast pump or sometimes a nipple shield to take care of the cracked nipples. Fungal infection is also very common, what we call as oral thrush in the baby, and also a fungal ulcer can appear on the breast nipples. With doctor's consultation, you can use antifungal ointment, and also in baby you can have some antifungal drops to take care of the problem. So breast milk is an ideal food and we called as a gold standard, and you can give exclusive breastfeeding for first 6 months and help in the baby's normal physical, mental and emotional growth. If you like this video, please share with your family and friends and subscribe the channel.